The opinions expressed in the following programs are those of the participants and do not necessarily reflect those of Rogers nor Rogers TV.
Welcome to Mindvine, the mental health show presented by Ontario Shores Centre for Mental Health Sciences. I'm your host, Daryl Mathers, and today we are talking about schizophrenia and the facts and myths associated with it. Just 1% of Canadians over the age of 10 live with schizophrenia, and despite perceptions in the media, people with schizophrenia are far more likely to harm themselves than be violent toward the public. To learn more about schizophrenia, I am pleased to welcome Dr. Phil Klassen, VP of Medical Affairs on Ontario Shores. Welcome, Dr. Klassen.
Thank you.
Maybe we can just start the discussion by talking about what exactly is schizophrenia.
Schizophrenia is a mental illness that tends to have its onset fairly early in life. For males, often late teens, early 20s. For women, a little later, maybe a decade later. It's an illness that is a product of both genetic influence and environmental influences. And the symptoms are in a few particular clusters. These individuals will tend to have some psychotic symptoms like delusions and hallucinations, some so-called negative or deficit symptoms, a certain degree, at least initially, of functional loss, and also sometimes cognitive or depressive symptoms. Schizophrenia is not exactly the same from person to person. It looks a little bit different, but those are the key elements.
You mentioned the cause might be genetic or environmental. I wonder if you can elaborate a little on that. So genetics is pretty easy to understand, but when you talk about environmental causes of schizophrenia, what exactly are you talking about?
Most mental illnesses are the product of interaction between a person's genetic predisposition and certain kinds of environmental events. Now, really understanding exactly what those events are and exactly how important they are to development of a mental illness is often difficult to know. It's a bit elusive. There are some environmental events that have been associated with the development of psychosis. I don't think we've covered the waterfront. I don't think we fully understand that. But we know that the environment is clearly relevant because even people that are quote-unquote genetically identical twins, when one of those two develops schizophrenia, the risk of the second twin developing schizophrenia is less than 50%, which clearly indicates other factors are at play.
In terms of diagnosing schizophrenia, is that a difficult process?
It can be challenging in particular circumstances. It can be challenging early in the course of the illness, just as the symptoms are developing. You know, oftentimes you see an adolescent male who's beginning to experiment with cannabis or other drugs and seems to be withdrawing socially and pulling away from studying, it's not clear at that point exactly what's happening. It sometimes takes some time to understand that it is a process where the young person is developing schizophrenia. Another significant confound is heavy substance use. Heavy substance use can sometimes produce a picture that looks like schizophrenia, but need not be. And then, of course, there are cross-cultural elements. We should be able to diagnose this illness effectively across different cultures, but we just need to be aware that the expression of distress, including psychotic symptoms, can vary from culture to culture.
What about in terms of treatment? Somebody with schizophrenia, what type of treatment options are available to them?
So there's a range of excellent treatment options, and these for Ontario are articulated at the Health Quality Ontario website, the quality standards for schizophrenia, for the assessment and treatment of schizophrenia. Some of the key elements obviously include medication treatment to help manage the psychotic symptoms, but also certain kinds of psychotherapies and certain other kinds of rehabilitative processes, for example, vocational training and supportive employment.
Schizophrenia is a word that evokes a lot of images for a lot of people that may not actually be factual. In your experience, what are some of the greatest myths associated with the disease of schizophrenia?
I suppose there's sometimes a sense amongst lay people that schizophrenia has to do with sort of two parts of a person or multiple personalities or those kinds of things, a schism, if you will. That might be the bridge that got us to that myth, which isn't true. Schizophrenia has nothing to do with that. I think the other pervasive myth is that people with schizophrenia have a really serious illness, and good functional outcomes are very difficult to achieve. And I think that we need to recognize that you can achieve good functional outcomes, that there is a significant number of people with schizophrenia that can do very, very well.
We're talking about schizophrenia, but in all mental illness, especially complex mental illness, recovery can look really different, and you kind of alluded to it in your last response. So when we talk about recovery from mental illness, when it comes to the treatment of schizophrenia, it may not be how you picture it, but there is a way for people living with schizophrenia to move forward in life.
Absolutely. I think one of the key things for a treatment provider is to work with the person with schizophrenia to articulate what their goals are. You know, we need to understand what really matters to them, and then work with them to achieve those goals. Now, there's usually certain steps in treatment that you need to implement in order to have a person in a place where they can reach those goals. But at that point, it's critical to work with them on the goals that matter to them, whether that's relationships, whether that's meaningful activities, whether that's work, what have you.
Being such a heavily stigmatized illness in the mental health world, on Ontario Shores at least, schizophrenia, or people living with schizophrenia, are often isolated in terms of treatment. But when there is family involvement, can the family make a difference in terms of the trajectory of that person, in terms of their treatment and recovery from schizophrenia?
Yeah, we know that. There's clearly evidence on that point. Family engagement is very important, both at the level of education of the family, but also there's a specific psychotherapy called family intervention training that helps families to help the person to stay well, avoid relapse, and avoid rehospitalization. So that engagement is really critical.
As we get close to the end of this segment, I want to ask you about people living with schizophrenia and their ability to live a meaningful life. You kind of touched on it a couple times, but it is such a stigmatizing illness. Can people who are diagnosed with schizophrenia live a meaningful life?
Absolutely. I mean, again, there's variability of outcome, but certainly I've seen people that have had amazing outcomes after an initial episode. I think that one of the things we should bear in mind is that for some persons with schizophrenia, repeated episodes of illness or prolonged duration of untreated illness may contribute to a more difficult process to achieve the functional outcome they want. So it's important for us to make sure that we're responsive to persons with schizophrenia, treat them early, treat them consistently, keep them well. That produces the best outcomes.
Thank you, Dr. Klassen. The conversation continues as Julie Van Hardingsveld welcomes our Kareem Mamdani, President and CEO at Ontario Shores, to talk system, stigma, and awareness as it is related to mental health. That's coming up next.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Welcome back to Mindvine. My name is Julie Van Hardingsveld, and I'm the External Relations Specialist at Ontario Shores Centre for Mental Health Sciences. It is my pleasure to welcome Kareem Mamdani, President and CEO, to our show. Thank you so much for joining us here today. Before we get started, I just want to share that in our community and beyond, you are truly leading the way as it comes to mental health, so thank you for that. My first question for you: as a new patient who may be receiving care, whether that be inpatient or outpatient, what experience may they come to expect from Ontario Shores?
Well, one of the things that we pride ourselves on Ontario Shores is that you will be felt very welcome at Ontario Shores. And you'll have an opportunity to work with an interdisciplinary team, a group of people who are there primarily to support you. You're an expert in the illness that brings you to Ontario Shores, but they're experts on how to help you to overcome that illness. There's a lot of work that we will do, both in terms of therapy, but also in terms of bringing your experience into the care plan that we will develop together with you.
Excellent, thank you. That's a wonderful segue to my next question, which is, how does lived experience work its way into the recovery model?
So the reference that I made to a care plan is really about how together we're going to work to make you better. And so that is about your experience as a lived person and the experience and expertise that the care team will bring to the table. And together, we're going to be able to determine what are your goals, what is it that you're looking for in terms of what success would look like for you, and then some of the things that we need to do to make sure that you are able to get to that. What are the steps we're going to take together to get you to that end goal that you've asked for us?
Excellent. How does, or what does patient and family-centered care mean to Ontario Shores?
So, that's foundationally a part of what Ontario Shores is about. And so our new strategic plan, which was launched just this year, makes strong reference to the way that we're going to work with patients and families. And so if you think about patients, we take a very broad view, not only of the individual who is receiving care, but of their family. And so their families are also part of it, provided, of course, that they're welcome to be a part of it by the patient. But we also have a number of mechanisms within Ontario Shores to make sure that we're hearing the voice of the patient. And so whether that's patient counsel, family counsel, whether that's sort of individuals who have been placed as family guides within each of the programs to help the programs to hear the voice of the patient through that lived experience, whether it's through ways that we might be able to co-design services at the organization. So there's many mechanisms by which we are actually bringing the voice of the patient and the family to Ontario Shores. And I think that's an important part of the recovery process that an individual goes through, because they are seeing them in themselves, the ability to shape what their environment looks like.
Excellent. Okay. A term that we frequently associate with Ontario Shores is innovation. What does innovation mean to Ontario Shores?
Well, it's a topic that could consume the entirety of our time, but I'm extremely proud of what Ontario Shores has done around innovation. I mean, we were the first hospital to be a HIMSS Level 7 hospital, which means that we are fully electronic. We don't have any paper in the organization in terms of the care that we provide. It also means that we are able to build tremendous innovation into the process. And so things like a portal for patients to be able to access their information. The ability to be able to actually influence what's in the portal by being able to view it and then be able to provide commentary on it. But it's also about softer innovation. So those are sort of technological innovation, but we have a lot of soft innovation. So the ability to work with researchers around new care delivery pathways. So, we are a site that has recently introduced things like RTMS, which is a transmagnetic stimulation of the brain as a form of therapy for depression. We have introduced ECG as a regional service, ECT rather, as a regional service. And so we have a number of different ways that we are introducing innovation, both as technologies and as well as models of care and delivery of care.
Excellent. Thank you for the brief summary. I imagine we could be here for many segments talking about innovation and all the wonderful things that Ontario Shores does. Before we wrap up today, Ontario Shores recently unveiled its 4-year strategic plan. Are you willing to share a little bit more about that and how it came to be?
Yeah, when we first started with that whole discussion, it was about how could we engage our community in that conversation. And so through that process, we looked at focus groups. We looked at a variety of different mechanisms. We probably had about 400 or 500 people that have been involved in developing the plan. And there's 3 components to the plan. The first is about how we care for people, and and that has a very strong sort of plan around it. Then how we will look after our own staff, right, and what that looks like, and how we will engage our staff and the well-being of our staff. And then the last is really about how care is going to get evolved, and we're really looking forward to sort of actions associated with each of those areas of our work.
Excellent. Thank you for sharing that. Look forward to seeing that roll out over the next 4 years and celebrate its success. Thank you for joining us today.
Hey, I'm Chef Corey Dern, host of a show on Rogers TV Georgina called Cooking with Corey. Join me bi-weekly for brand new episodes where I teach you not only what to cook, but how to cook. The only thing missing is smell-o-vision. That's Cooking with Corey right here on Rogers TV Georgina.
When it comes to mental health, we all have questions. Same is true when it comes to Ontario Shores and the services we provide people impacted by mental illness. That's why we are proud to present Ask Ontario Shores, an opportunity to have your questions answered by staff, volunteers, and patients from Ontario Shores. Whether it is a question about symptoms, treatment, or directions to our main hospital site, we are pleased to provide you with a chance to learn more about Ontario Shores and mental health. If you have a question you would like answered by Ontario Shores, send it by email to communications@ontarioshores.ca, and it may be included in a future episode. Now I hope you enjoy this episode's version of Ask Ontario Shores.
My relationships were not great at home. They were not great at work. I was terrified all the time at work, constantly thinking I wasn't doing a good job, constantly thinking I was going to get fired. I was always looking out for protecting myself, and that rubbed a lot of people the wrong way. I didn't know what was going on, and neither did they.
The Traumatic Stress Clinic is an outpatient service at Ontario Shores where we work with individuals who have experienced some form of trauma in their lifetime. These individuals may experience post-traumatic stress disorder symptoms or trauma-related symptoms, and we have an interdisciplinary team comprised of a psychiatrist, a psychologist, registered social workers, registered nurses, and psychotherapists that provide cognitive processing therapy. Trauma is something that's very common. So about 80% of individuals experience some form of trauma in their lifetime, and about 20% of individuals actually get the diagnosis of post-traumatic stress disorder. It's important to understand how trauma impacts our quality of life because it interferes with different perspectives that we have about ourselves, other people in the world, and it can activate really strong emotions like shame, anger, guilt, blame, sadness, you name it, which impacts our quality of life. So addressing trauma is really important for us to understand the rules that we live by and recognize ways that we can implement more balance in our perspective to work towards that quality of life that we deserve and we desire.
I started to see positive changes in my mental health very soon, I believe, after group therapy started. So I went through the period of assessment, which took a couple of months, if I recall correctly. And then group therapy was a few months. And it was in a matter of just the first couple of weeks. Heck, even the very first group therapy, not that I hadn't heard this through my counselor during the assessment period, but that phrase, extreme circumstances cause extreme reactions. And to be told, Robin, you're absolutely normal, was a gift to hear that over and over again, I'm normal. For the circumstances I lived in, my reactions are normal. And that was fabulous right from the beginning.
When receiving care at the Traumatic Stress Clinic, the model that we like to use is avoiding the avoidance. So what we know is to survive really painful feelings and memories, we start to engage in different avoidance strategies to disconnect, numb, or suppress from the past. So the therapy entails kind of like getting into a hot tub. I like to explain to clients that when you first get into a hot tub, it's really hot, it might burn and sting, but if we leave our body there, then we adapt to the external circumstances around us. So that's kind of what this therapy is about. It gets worse before it gets better. And that's because we're trying to engage in more strengths and helpful coping strategies to tolerate really painful memories that help us to process the different emotions and the different reminders that take us back to the past.
How grateful am I? Words can't express how grateful I am for this therapy. I'm 50 years old, and one might think that that's too late. It's beautiful because it's never too late, and it's beautiful if someone young comes in and gets this and has a beautiful life ahead of them. The relationships I've had with my counselor and the psychologist here at Ontario Shores has been nothing short of a miracle and phenomenal. They are absolute wonderful examples of humanity, pure kindness, no judgment whatsoever, unconditional kindness and acceptance. The question I received from my counselor was, have you remembered any previous traumas since group therapy? And my response was something to the effect of, yes, but I remembered as well as I do yesterday's breakfast. It doesn't torment me. It's just a story in the past, and there's no torment to go with it. And I am so grateful for that. I say don't hesitate. Just get on the wait list. Just call, get that referral. Don't think about it, just do it. Don't think about it, just do it.
Hi, I'm Angel Morgan, host of Raising Energy on Rogers TV. Join us each week as we are back in the studio doing live psychic readings. Check out rogerstv.com for airtimes.
Recovery is embedded in everything we do at Ontario Shores. Recovery from mental health can also mean different things to different people. Each episode, we are proud to bring you Recovery Moments, a segment where staff, volunteers, patients and families, and community members highlight a recovery experience from their personal or professional lives. Recovery Moments inspire our staff to keep making a difference. Here are this episode's Recovery Moments.
My recovery moment is when one day walking through clinical units, a patient approached me and just asked if I was interested in music. And I explained to the patient that I love music, and I think music is very therapeutical and really helps me in my day-to-day. And so the patient and I created that little bit of a bond that he loved music and started talking about classic rock music. So every day or in the hallways when the patient saw me, I would take the time to have a conversation with him about what album he was listening to, what type of music he was listening to finally one day when seeing him getting ready to leave the facility, he took the time to say that the conversations that your staff and you had with me every day helped me get to this point where I can recover and leave Ontario Shores and know that I have common interests and goals with music with other people, and that was one of the memories that he was going to take away from here.
My recovery moment is related to the work that we've done with our patient portal and with advancing our patient engagement strategies between our patients and our clinicians that we work with. Through having access to a patient portal, patients can get their documentation electronically, they can see their records, and they can securely message with their clinicians and their care providers. What's been really exciting most recently, we've now had the ability for patients to document directly into their electronic health record through the portal. And with this, they can add their own recovery goals, and they can communicate with their clinicians and be a contributing member to their record, which really has our clinicians and our patients partnering together and really advancing our recovery environment.
My recovery moments really center on seeing each of the adolescents leave the unit, honestly. The discharge piece is when I feel that sense of joy, happiness, because I know as a team, we did a really good job and the child's going home. That's usually my recovery moment. It makes me the happiest to see the youth leave our unit and knowing that they're going to be successful and knowing that they have the skills and seeing that big smile on their face, and that's my recovery moment.
Hi, our recovery moment is Shane's Shore Run, which takes place here at Ontario Shores on September 25th, 2022. It is very dear and to our hearts, as is Ontario Shores. It has helped both Mel and I deal with the loss of our son Shane in keeping not only his memory alive, but also promoting awareness for suicide, awareness for youth mental health. And it brings the community together, and it shows Ontario Shores in a different light. It shows Ontario Shores as giving to the community as much as the community gives to Ontario Shores. So we hope you can join us. Thank you.
I'm Jennifer. And I'm Allison. Coming up on the next parenting show, we're talking about stress-free family holidays. Well, we're certainly going to help you reduce your stress and get you organized. That's only on Rogers TV.
Thank you for watching this episode of Mindvine.
If you are in crisis and require emergency services, please visit your closest hospital emergency room or dial 911 to reach emergency medical services. For more information about mental health and the services provided by Ontario Shores, please visit ontarioshores.ca/gethelp to learn more.
If you have a mental health story you would like to share or have recommendations for a topic of a future episode, please contact us by email at communications@ontarioshores.ca. Thanks for watching.